Welcome back to another episode of Pretend I Don't Know Anything. I'm Mike Jones. I'm here with a special guest, Grant Young. He's been on a couple times. Thanks for coming back, Grant.
Yeah, happy to be here.
Um, so we've been talking quite a bit, you and I, and the same thing keeps coming up over and over again. Or we're talking to individuals, and what we keep hearing is, oh, well, they're mental health primary. There are substances involved. And I feel like people may be confused about what that means, right? And I'm going to talk a little bit about my own story with this. I know you've got some things to discuss with that as well.
Yeah.
So I was, it wasn't a formal diagnosis for me, but I was told over and over through my use that I was believed to be bipolar. When really it was the substances that were driving all of that. And professionally, what I found is that regardless of which one is primary, we can talk about like where to start or triage with all that stuff. Regardless of which one is primary, if they're not being treated in conjunction, right, then one will undermine the other. And what I mean by that is if it is mental health primary, but they're still using amphetamines or THC or hallucinogens or even cocaine, then or alcohol, any substance, it is going to undermine the mental health treatment that's going on, right? It's like almost impossible to treat the mental health while somebody is actively using substances. Not only is it incredibly difficult to diagnose that and what's actually happening there, but to treat it in general. They continue to use this substance as a coping mechanism. And many of these substances are going to cause mental health problems and symptoms. It's only going to make it worse. Now, if it's the other side, which what we know now is that very rarely is somebody just substance use. It is almost always, 99.9% of the time, and even that 0.1%, I think, it's still underlying mental health issues that are involved.
Yeah.
So if we're a substance primary facility and they're not treating the mental health component of this, then it's going to undermine it as well. Because the mental health side that's being untreated is going to cause relapse and cause them to go back out. And so I guess why I wanted to talk about all this and what I always say about it is it's the chicken or the egg. Or for me, it doesn't, not that it doesn't matter which one is the chicken or the egg, but if all we're looking at is the egg, we still have a chicken to deal with.
Yeah.
Right? And if all we're looking at is a chicken, we still have an egg. So no matter which one came first, they're both present and they have to be dealt with, Mm-hmm. And I know, we've talked about this from your own history.
Yeah.
And you having similar.
Yeah, almost the same diagnoses.
Yeah.
I mean, I was diagnosed 2 weeks sober as bipolar. I think it was bipolar 2. Don't
Mm-hmm.
quote me on it, but some form of bipolar. Extreme depression, extreme anxiety. Yeah. Impulsive anger, I think, was in there somehow, some way. But this is 2 weeks sober.
Yeah.
My story when we talk about like the chicken or the egg, I don't know still which one came first, mental health, substance. I have a feeling that the mental health started creeping into my life, which I turned to substances in order to self-medicate those, which did not help my mental health, which increased my mental health, right? But in my story, I was primary substance abuse. I'm using air quotes because, again, I don't know. That's the treatment I went to.
Yeah.
And at 10 months sober, I engaged in a mental health primary, kind of an outpatient program through Yale University. And it was a real specific DBT type program. They put 100 of us in like this big room, and there were 10 to 15 of us picked out. Wasn't good news if you got picked. I got picked. And we went down to the basement.
You made the team.
I made the team.
Yeah.
And I went through that program, and it really did change my life at 10 months sober.
Yeah.
Because it started to get me to understand like what my mental health was actually doing. I think where I get concerned, and whenever I'm speaking with families or professionals, where we're so focused on what is primary, what is secondary, in order to create the treatment plan, where what I find concerning is when it's, in air quotes, mental health primary, but there are substances involved. When people are searching for solutions for the mental health portion, I'm not in disagreement of that.
Yes.
I'm in disagreement of the continuing care of we have to deal with the chicken or the egg at some point. So when we find stability with our mental health by going to maybe like a inpatient treatment center or residential treatment center, sometimes short-term or long-term, whatever works for that person, it's the aftermath of when are we going to start dealing with the substance abuse. Because I think sometimes we're telling individuals, well, as long as you have your anxiety or your depression or your schizoaffective or schizophrenia or bipolar or whatever have you, if you can get that in line, then you can just live normally. And that is not the case for some people. That is not the case for me. How many times have we seen THC-induced psychosis nowadays?
All the time.
Most
All the
cases,
time.
you know. And these are individuals that believe that I've gone to treatment, I've treated my mental health, and I have a really good game plan, and they're finding them to be unsuccessful when it comes to navigating when they get into the real world because we're using substances. And so, it's just been an interesting like topic, I think, in our industry and based on our conversations around the country with different professionals of, you know, a lot of talk of this is mental health primary and this is substance abuse primary. I mean, I understand most of them coexist. And so I think not just us two, there are many people out there that are all putting our heads together to figure out what would be an appropriate solution for these families. But to just deal with one and think that the other one's going to go away because we dealt with one is foolish, in my opinion and in my experience. We have to deal with both at some point or another. Maybe we highly focus on one area and then transition. For me, it was substance abuse first, then mental health. Some maybe mental health first and then substance abuse, but both need to be in the picture.
Yeah, no, I agree. And there are those times where it's like the symptoms from the mental health issues are so extreme that has to be stabilized first in order for any treatment to take place. And inversely, the substance use, what's going on there is so extreme that we have to stabilize first and then proceed with treatment. And that is a normal starting point in all of this. I mean, my own story, it was mental health first. I was, I was so anxious and so much shame and depression before I ever started using. And I found alcohol to be, at that point in my life, 10 years old, that alcohol was very effective for treating my anxiety at 10 years old. But I didn't even realize that's what it was. Like I didn't know that's what was going on. And oftentimes that's what's happening. That somebody is suffering from mental health issues and they're seeking the substances to self-medicate that. But then the substances take control. Right. And that becomes a problem. And they're worsening the depression, the anxiety, and the mental health concerns anyway. And also my experience, which I'm sure you've seen as well, individuals that have mental health issues tend to go to the substances that are worse for that. Right. Like in my case, the depression seeking alcohol, right? I had depression and anxiety. I'm using the alcohol to treat the anxiety. Alcohol is a depressant. It doesn't really work well for the depression, right? And eventually it doesn't work for the anxiety either. But so we see that all the time. And that's kind of the thing with like, we've got to work on both of these. And really, I believe both of them simultaneously. So if we can get stability in whichever area is most severe, then both of these need to be worked on. Because if we just address here, then this one will crop back up.
Well, I think there's something to be said too, dependent on the case, of let's see what happens when we remove alcohol and narcotics from this person's system. Sleeping, health, appropriate medications to get them through, appropriate sleep patterns, diet, activities, accomplishing things. Like, what does that person look like when that's the case, to figure out a baseline to be able to actually appropriately do a testing.
Yes.
I mean, how many people do we see doing testing and they are not sober, or doing testing a day after they have stopped or a week after they've stopped? I mean, yeah, some stuff's going to pop up on those tests. You know, like I've been doing cocaine for 4 months. Some things are going to pop up on that test of
Yes.
like where I'm at mentally. I'm
Wait.
not thinking correctly.
You're saying that if you've been using a mind-altering substance for an extended period of time, that would alter testing on your
Yes.
mind.
Yeah.
Huh. It's
And the
interesting.
testing piece, so we work with a lot of places that do testing. I've just seen it a lot of times of if we're trying to establish what the problem is,
Yes.
it's really difficult to do when they're first coming off. You know, if I turn the engine off and I pop the hood and I say, man, that engine's really hot, it's like, it was running.
Yeah.
It was running.
Yeah.
So, it's just a matter of, for me personally, and for a lot of the guys that I've worked with and that we've worked with, is let's find a base level of, we haven't been using, we're testing clean on drug tests, we've been doing some actions. It doesn't have to be always 12-step oriented. That's what worked for me.
Yeah.
But even in our literature, it says sometimes we need to trust the professional,
Yes.
So I get that, but we need to be sober in order to actually figure out what's wrong.
Yeah. Well, and on the other side of that too, I need to be stabilized mentally in order to work a recovery program, whatever program that's going to be. Like I guess where I get frustrated with it all is that we continue to act like these are two totally different things.
Yeah.
And that the Venn diagram does not overlay. Like there is this neutral ground, and actually it's probably a pretty wide margin there. There that both of them are at play. It's not this or that. It's this and that.
Yeah.
And it's this and that most of the time. There are instances, it's just that mental health. There are much fewer instances, I believe, where it's just substance use.
Yeah.
When I started working in the treatment industry, like 15 years ago, there was still the idea was very prevalent that, it's just alcoholism.
Yeah.
Right. And we say all the time, like, there's not just the vanilla alcoholic anymore. Like, that's just not. And there never was. We just didn't. We weren't as sophisticated. We've gotten better at this over the years.
Yeah.
We have the knowledge. We have the experience now to recognize that and address it appropriately. And it needs to be addressed appropriately from both sides.
I was a minority in the Medline.
Yeah.
When I got sober.
Yeah.
It would be an outlier if you're not in the Medline these days.
For sure.
All my peers that I was in treatment with, in hindsight, looking back, they absolutely were dealing with something.
Yeah.
There just wasn't a lot of, there was fewer diagnoses being thrown around, fewer testing, fewer knowledge, I would say, less knowledge about that stuff. But
well, I do want to continue on this topic.
Cool.
Because there's a lot more to kind of uncover and unearth and go into this. The thing to take away from what we are talking about here is, regardless of which came first and where you are in that, I would say more of a spectrum in any of it, there is help available. Like all of this can be treated. It all can be treated, and you can be healthy and find wellness in it. So reach out to your professionals and get that. And thanks, Grant, and we'll be back with another episode.
Cool.